Hello there, this is Wellbeing on Spectrum Television, your ultimate guide to health and wellness. My name is Sandra Agu, and I'll be walking you through this wellness journey one step at a time, but I won't be doing this without the help of experts in the field. Whenever it's time for Wellbeing on Spectrum Television, then you know it's time to grab a paper and a pen to jot things down, because Wellbeing promises to be educative and informative. Now, to stay connected, do not forget to follow us on all our social media platforms and subscribe to our YouTube channel, all of which you can find on spectrumtvlive.ng. Now, I know that a lot of us just go to the pharmacy and get paracetamol when we have headaches, then go ahead to take a dose or two and then abandon the rest for when the headache comes back. Or we go to the hospital when we get sick, and when we are given medications, we abandon it at the slightest feel of wellness. Do you know the implication of this? Well, that is why I brought Dr. Pius Okon, who is a medical consultant, on Wellbeing today to educate us on medication management. But before we meet Dr. Pius and delve into the conversation for today, let's enjoy this report on medication management put together for Wellbeing by Emedion James.
Medication management refers to a comprehensive process of overseeing and optimizing a patient's medication regimen to ensure safe, effective, and appropriate use of medications. It involves various tasks and responsibilities, including prescribing, dispensing, administering, monitoring, educating, and coordinating with healthcare providers and patients. The goal of medication management is to achieve the best possible therapeutic outcomes while minimizing the risks of adverse effects and medication errors. It requires collaboration among healthcare professionals, patients, and caregivers to tailor treatment plans to individual needs and circumstances. In November 14, 2023, 100 pharmacies closed down within 3 months in Ghana over illegal operations, wrong drug prescriptions. Quoting a study conducted by Ogunleya et al., a consultant physician and clinical pharmacologist on medication, says errors amongst healthcare professionals in 10 tertiary hospitals. He said 35.5% of 2,386 professionals that participated in the study reported medication error, while 33.4% did not report. The Institute of Medicine report implicates medication errors at least in part as a direct cause between 44,000 and 98,000 patient deaths annually in the United States. The WHO Regional Director for Africa, Misuse Motier, said there was a high magnitude of unsafe medication practice among low and middle-income countries, including Nigeria. According to her, global estimates show that medication errors contribute to over 3 million deaths every year. Medication management is a multifaceted process that requires collaboration, communication, and coordination among patients, caregivers, and healthcare providers. What could be the several factors that can contribute to challenges in medication management? This and many more are what we will be talking about on today's show on Wellbeing.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
Thank you so much for that, Emedion. Thank you so much for that report. Well, I have Dr. Pius Okon with me in the studio, and we'll be taking a look at the issues together. Medication management, talking about medication misuse and adherence. Thank you so much, Dr. Pius, for joining me on Wellbeing. What would you say might be the cause of this? Are there situations where maybe your body might react to a particular drug prescription? Maybe it would have been what was good for you, but suddenly it's not, because like the wife said, it was supposed to be half a dose or half tablet, but he was asked to take 2, and which led to his death.
Okay, well, thank you very much. What I would say is to that is there are so many medications that should not be given over the counter. but because of people's access to the pharmacy for control medication, so they can take these medications without the prescription of the doctor. And that we will now have all this confusion that leads to, unfortunately, this mortality.
Because lots of people are confused about the issue. They know there are sometimes that you go to the hospital, you get medicated. Let's say I know that since I've been to the hospital, when you get to the hospital, a doctor looks at you, diagnosis, then send your medication to the pharmacy, and then you go there and...
Sorry to cut you in. The doctor even has a history of your kind of medications that you're taking. You must have known what you're taking, the medications that you react to, so that they cannot give you this kind of medications. Also know that there are some medications that if you take with combination with something else, it can cause some catastrophic reaction. So
okay, before we get to all of this, because this is going to be really, really deep, let's start from the beginning.
Okay.
Our conversation today is going to be medication management. And I thought this was important for us to talk about because we know that, look, in Nigeria in particular, we Nigerians abuse medications a lot. We abuse drugs a lot. Like, we know that 90% of Nigerians, when you have headache, you go to the pharmacy. You go to the chemist beside you. Some even patronize roadside medication vendors, just get paracetamol. And then we end up taking like a dose and you discard the paracetamol somewhere, hoping for the headache to come back, and then you continue. So I felt like we have to discuss about this because I do know for some reasons I feel like a lot is going on in Nigeria right now, and we need to start taking a look at the root causes of one, sudden death syndrome. Because a lot of things might be going on. I'm wondering, where is this coming from? So maybe when we break down all of these health issues, we might actually start to live right and maybe reduce this sudden death syndrome. But why do you feel like this medication management should be a conversation at this time?
Let's start with the situation in Europe or in the Western world. Small thing as paracetamol. You may need a doctor's prescription to get it. You go to a pharmacy, you want to get the drug and the medication, and you are told, sorry sir, please, you need to see your GP. You need to see your general practitioner. Everybody has a doctor attached to him. Even a doctor also has his own doctor that he has to get a prescription from. So now, when you come back home, everything is haywire. You just do it anyhow. So maybe the conversation can start from. In fact, there are rules, there are laws already dictating what should be the extent of what the doctor does and what the pharmacy does, and all the allied medical practitioners, professionals. So I think where the conversation should be, should I use the word activation of these laws, so that before no patient can go to the pharmacy without a doctor's prescription. There has to be a discussion on that. Whereby you go to the pharmacy and maybe there's something attached to it by way of fine or anything like maybe you go to prison or to even go to that extent. Yes. When you now start attaching what do you call it? As attaching fines for any particular misconduct, people will now take it serious. That's just my opinion anyway. I may be wrong. So that when somebody goes to the pharmacy and he was given something that is not over the counter, then maybe the pharmacist should go in for that. Because
and not just the pharmacists, I think hospitals also have a role to play in this. Because I remember, I'm going to talk about this one from let's say drug interaction. Because I know that a particular set of people that they pay attention to very well in the hospitals are people with ulcer. Gastrointestinal, whatever. So peptic ulcer. So when some people go to the hospital and you don't ask these questions, you just give medications, and then at the end of the day, because I'm going to speak from experience. There was a time I was ill, but I wasn't home. I was somewhere in Owerri, so I went to the hospital and I got some medications. I went home and I started taking the medication. Instead of getting better, I was feeling worse, but not in relation to what was happening to me. I almost
side effects of the medication.
So I went back to the hospital and the doctor asked, "Do you have ulcer?" I said, "Yes." He said, "You would have told me, but you never asked." So all of these things, I'm like, you should have asked me first. And you're saying I never told you, like it's something I should just be announcing while walking on the way. So, but if not that,
the question I'll ask you on that is that your personal doctor?
No, he's not. That's where that's where I'm coming to.
If he's your personal doctor, you would have had all those histories.
Yes.
That's where we also start from. Everybody has a personal doctor who has a history. Okay, you are allergic to chloroquine. You have itching if you take chloroquine. So the doctor knows that he cannot give you chloroquine. This one knows that okay, if you take NSAIDs are those drugs like your ibuprofen. You take as a painkiller, but it will now cause you ulcer pains. So your doctor already has that history in his head. So next time he's giving you any painkiller, he knows that he can't give you that kind of medication.
So that's where I was coming to.
When you are seeing Dr. A today, the following day you are seeing Dr. B, maybe, let me not vouch for him. Let me not vouch for him, but who knows? Maybe he could have been overworked that particular time and he has seen you in that period and he has forgotten. I'm not saying he did the right thing, but that period he has forgotten to ask you that important question. Do you react to ibuprofen or diclofenac? And you not take, and you now made that prescription, and you now go ahead and take it and now have those side effects. So, if all of us had our own personal doctor, who will have it in the head already, and it's already documented on your hospital folder that see Mrs. or Miss Sandra so and so also has this kind of an issue. So the doctor will not make that kind of a mistake, and the pharmacist will follow through. So
okay, now let's focus on this particular issue for a moment. So do you think there should be a way to create a system where maybe every individual's data, your medical data is attached to you some kind of way? I don't know how
there is,
but so if there is, why is it not being utilized enough? Because
a lot of challenges.
Maybe so everybody should have, the way your medical card has a number. Maybe you get to another hospital, just imputed, and your medical data should be there somewhere.
Where I work, we have this electronic way of recording patients' data.
Okay.
So that if you have a particular allergy or ailment or whatever that the doctor needs to know before he makes any prescription, it will just pop up in front of the doctor, so you know, okay, allergic to chloroquine, okay, allergic to ibuprofen and all those things. So he already has in his head, as helped by what is showing in the screen, that you cannot give him this particular one or have this particular one.
But so that's just for where you work.
But the challenge will be, these things are manned by electricity. You go to the remote rural area where they will see light once in a month. How are they going to handle that situation? How are they going to have an electronic system? Or even the ability to know the know-how or how to use the system? It may just be one person in that facility that knows how to use. So these are the challenges we have. But already there are all these systems in place.
But this system that you talked about now, is it like a national? Do all doctors or all hospitals have access to that, or is just for?
It's a hospital-based thing.
Just individual hospitals.
Yes.
So why can't there be some kind of synergy between all medical centers, all hospitals, so that you know that once your code or your number, just the way we have NIN, BVN, and all of that, once your number is 113 and you get to the hospital, not 113, and all your medical data is there, because like you said, that doctor might be overworked or something and he forgot to ask. And I'm wondering, maybe it's something that people should ask more often, because I know that if you want to go to the hospital as a woman, I know that all our females that are watching this program now can relate. And you're not feeling well. The first question is, when last did you see your monthly flow, or when last did you see your monthly cycle? That's always like the first question before any other thing. So maybe things like this can also be asked to as a follow-up to just to be sure that you are on the right path.
Already, you know that our health system is in shambles. That's why you see our medics, health professionals leaving or attempting to leave the country.
Yeah.
So this conversation is, I think, it's too big for 30 minutes. Honestly, yes.
Because now you mentioned that electricity and the power supply in the country is already an issue. So we're going to jot that down, electricity supply in the country. But now, before we keep talking about that, let it not look like we're talking about the role the government has to play in this. Let's keep talking about medication and medication interaction.
Okay.
The other day I was watching something and I saw where it said you cannot take medications with yogurt or milk. And in my mind, somebody crossed my mind like, wow. I know you've heard things like this before. I know people that cannot take medication without swallowing it with soda or something relating to that.
Yeah, makes it easy.
And then do you hear that it's very bad for your health? And we do a lot of things that we are not even sure of. And I feel like medication is something very delicate that maybe people are not even educated enough about the consequences of some of these actions. But like you said, it makes it easier. So people want to go the easier way.
You know, the doctors and the pharmacists, they work in synergy to sort that particular issue out. But like I mentioned about the electronic system where you have medications pop up. So what I would say today is that there are some medications that should be taken with drugs. Sorry, there are some medications that should be taken with food. And there are some that should be taken 30 minutes before meal, like your insulin, or 30 minutes after. There are some that you should not take with food. There are some that you should take with meal. There are some that you should not take with meal. There are so many of them. They are individualized. We cannot start talking about all of them. But the main thing is that whenever a doctor is making a prescription, he should be able to tell you the side effects of those medications and the best way to take it. Whether you should take it with meal or without meal. For instance, if you are taking, I'm giving you something now as an example. If you are taking an iron-containing medication, like your Astifa, I'm not selling Astifa now, or any other hematinics. Let me mention hematinics. If you are selling hematinics right now, you should take it while you are eating. In between meals.
Okay.
Let me say you take the first spoonful, and then take the hematinic before you now continue. That way, that side effect of abdominal discomfort would have been reduced. That is an information that your doctor is supposed to give you. And there's also some medication that should be taken with an empty stomach. There are some that you should take before meal. All right? Your insulin and all that. So these are, and apart from all that way of how to take the medication, the doctor should also tell you what to expect as side effects
of taking the medication.
This one you are taking Piriton. Sorry, maybe after 1 hour you may feel sleepy. So you may not take it during the day if you are going to work because it may make you to feel sleepy. So these are the little information. But that's, you miss such information when you now go directly to the pharmacist, who may not have the proper information. And sometimes you may not even take time to ask you if you are taking other medication before. So you now be having interactions and all that, like the history, the video we just watched now. So all those things will combine and can be very catastrophic.
Is it that doctors expect that the patients, like individuals, should know these things? Is that why you forget to mention? Because different doctors have different approaches to things. I remember one time I went to the hospital, and he mentioned that I should take omeprazole 1 hour before meal. And in my head, I was thinking, I thought they said it was after me. Because he was like, no, you'll be taking it wrong. And I was confused. So now I have two different doctors telling me two different things. You will meet another one and he will tell you something else. And you're wondering, why is everything...
Maybe for that particular situation. You know, there are no two situations for any condition. So you may be taking drug A for a particular ailment. But you may be taking the same medication, but you're solving some other problem, and the doctor will now be treating you for something else. I give you an example. There's this medication, I'll give you the generic name, I won't mention any brand, salbutamol. Salbutamol is useful for asthmatics, people that have bronchial asthma. can also be helpful to a pregnant woman while she's having abdominal threatened miscarriage.
Okay.
All right. So when you are taking the salbutamol for asthma, you will have the effect, but you may also have some other effects
in your abdomen.
All right, and other ones that I don't have to mention here. So maybe the situation that he was telling you was different for the other doctor as well. I don't know what I'm confusing you.
No, I'm very. I'm going on the same line with you. Okay. I'm just hoping that our viewers are, because I really thought about it, and I'm not going to lie, I did not out of my mind. I did not out of my mind because I was skeptical about taking omeprazole 1 hour before on empty stomach. So I just did it the way I knew how to. Which was? Well, after me. Okay. So that's why I said this conversation is very key, because lots of people do this. They misuse their drugs, they abuse their drugs, not because they just intentionally want to, but because they don't even know the right things to do. Like what I just said, I just took it after me because I'm used to that. I don't even know if that's the right thing or if it's wrong, but that's what I've been living with. So I just did what was on my mind. But let's talk about malaria medication, because I know recently somebody went to the hospital and he came back and complained that they gave him a particular malaria medication, but he will not take it because that's not what he's used to. So he has a particular brand that he feels works for him. So he decided to discard one that was given to him at the hospital. And now went to buy his own brand. And went to buy the one that he feels works for him. Okay. And we have lots of Nigerians doing that. I feel like that's another medication that is mostly, aside paracetamol, the next is malaria medication. And people just feel like there's a particular brand that works for me. And they don't understand resistance. Because they don't know that. They never checked. And for doctor to give you a particular malaria brand or malaria is because that's what your malaria is not resistant to. You might end up taking what you feel like you're comfortable with, and for the meantime it might just, but months later it's going to come back. So people don't understand this whole branding of malaria medication, because I think malaria medication is even more abused than paracetamol. Yes. True. Well, that was just a thought. I didn't have data to that. So a lot. So it's even more abused than paracetamol. It is. Or maybe they are abused at the same level because they always go together. Paracetamol and anti-malaria. Well, these are the issues. So in regarding that particular and I also learned something new. I think I learned that sometime last year, that you don't take malaria medication with vitamin C. I know that somebody watching just like, yes, you don't take malaria medication with vitamin C. Theoretically. Okay. Vitamin C are antioxidants. Alright? So they have the tendency to reduce the efficacy. So theoretically. Okay. But some people still do it and it still works. So theoretically, vitamin C is an antioxidant that tends to... Now, the malaria drug works by causing oxidative stress. No, it's not too... well, let me still say it. It causes oxidative stress to the cells and to the parasite. That is how it kills off the parasite. Now, when you now take an antioxidant in the form of vitamin C or any multivit, you are inadvertently counteracting the effects of the malaria drug. So why not wait till after you are finished with the malaria drug before? But nobody told us this thing. Because they did not go to the hospital. I'm sure that did not come from the hospital. True. So they did not go to the hospital. So they just... But even if you don't go to the hospital... theoretically. Because I know some people that still do that combination and it still works for them. But I think it's based... I think a lot of people do that because they feel like malaria medication is bitter, so they just use the vitamin C to color it off. So, but even if you don't go to the hospital, with the rate at which Nigerians patronize this roadside, most of them know, these pharmacies, I think for some reason, maybe they should be equipped with the kind of knowledge that they deserve to give to Nigerians, or Nigerians deserve. Because for some reason, somebody is endorsing them and giving them license to operate. Not to prescribe. So what is supposed to be their Q rules if they are not prescribed? I'll leave that job for the minister. Because if you're not to prescribe, okay,
Yes.
it's more like the hospital prescribes, then you go
Yes.
there and buy.
And dispense. They dispense and they reproduce. They don't prescribe.
I hope somebody just picked that. He said that the pharmacy close to you is not supposed to just sell drugs to you. You are supposed to go to the pharmacy with a doctor's prescription, which means that tests would have been carried out on you in the hospital,
Yes,
right?
and
Then drugs will be
thoroughly reviewed and examined, and then they will now know the best form of medication to give you. Let's not forget that there are what we call over-the-counter medications. Those ones that you can just walk into any pharmacy and just pick it up. You don't have to see a doctor before you get them. But we're not talking about those ones.
malaria drug should be part of it.
No, it's not. It's not, because you have to be tested.
Okay, so
All
which
right,
ones are
yeah.
the over the vitamin C should be part of
Yes, it's over the counter.
but people abuse vitamin C. Do you know what I'm going to
How?
now?
How do they do
You
that?
know the vitamin C capsule, the one you turn into, you put
Okay,
it,
the one
you dissolve in liquid.
The effervescent.
People
yeah.
have turned it to juice. So
Okay.
is that not an abuse of?
It's an abuse. It's an abuse. It's an abuse. So we have to educate them. I feel that's why we are here, right? So we have to educate them. There's a particular limit that your kidney and your liver can do to excrete all those metabolites of all those medications. So we shouldn't take too much. I'm sure that those leaflets will tell you how much you should take per time. And
Do
how
you really
many-
think Nigerians
How
go
many
through
should
the
read?
leaflets in their
it's
medication?
It's not Coke. Even Coke, you cannot take more than one bottle of Coke a day now. Abi?
I want to call names, but I don't want to
Please.
drag anybody on.
Please, I beg.
But people do that. You see people that take 2 to 3 bottles of Coke in a day, and when you ask them, they seem to have reasons why they do things like that. They say, I'm tired, I just need energy. I'm hot, I need something cold. At different times of the day, they have reasons why they've taken a bottle of Coke. So I know people that
not
abuse this
good.
vitamin C, and they have their reasons for doing that. Because if you ask them, they want their skin to look brighter.
glow.
They want their hair to look longer. And they feel like you need to take enough vitamin C. But the question is, how much vitamin C is enough? You talked about reading the leaflets in your...
The dosage is 500 to 1,000 milligrams per day. Per day. You can decide to divide it into some
Morning,
doses,
afternoon.
morning, afternoon, but it should not be more than 1,000. It can be about 500 or even less. That's the dose. But so maybe that sachet may contain about, I don't know, maybe 200 or 500. So that means you shouldn't take more than 2 or 3 of such in a day. In a day. That's also, you should know that you also have vitamin C naturally occurring in your fruits. All right, your oranges, your citrus, mango, pawpaw, and all that, they contain this vitamin C in abundance.
So for somebody that already takes the soluble vitamin C daily, and you take orange again sometime during the day, maybe I know that some of those soluble vitamin C's come in like 1,500 depending on the. So you take that and you still have oranges and fruits during the day. Does this interact or?
Well, what will happen there is that since the one from the fruits are naturally occurring, it will be easier for the body to excrete them without damaging your organs. It is these ones that were manufactured in the lab and all that that we should be worried for the dosage. But you can take your orange, maybe 5 or 10 fruits, no problem. Your body will find it. Since it is natural, it will not really have so much effect in the system as those other ones. Because in truth, that vitamin C that you see in that sachet is not just vitamin C. There are other preservatives, other chemicals
in it.
Yeah, and those chemicals are the ones that may cause you all this.
So it's
problem.
obviously better for us to go the natural way if we really want to ingest vitamin
exactly.
C. Okay. Now, quickly before we round up, because we're running out of time.
Okay.
How can we now properly manage medication so that to avoid misuse, overuse, especially in cases of long-term or mid-term medication? Let me take, for instance, typhoid medication that is 7 days. Some people, after 5 days, you feel like and then you discard the remaining 2 days.
Stop.
And then some people, when they feel somehow like they just take like a day or 2 doses, maybe they take the remaining ones.
Let me explain that. Let me give you a scenario.
Okay.
Okay, maybe you have some let me use robbers who came to your house. Okay, you are told that they are in a particular compound. Now, you are told that you need to send in 10 missiles into that compound before you can kill everyone. Now, you send the first missile and it kills the ones that were outside, maybe in the perimeter fence. You now send the second one, you now kill some, but there is one or two that is still inside the room, and you have not completely given the 10 bombs. So don't you think that if those ones that you did not kill, when they regroup and when they come back, what will they do to you?
They will come for you.
Yes. So that's why you have to complete your medications, even when you have started feeling better. It means that the drug is working. It doesn't mean that it has completely cleared the ailment from your system. You have to continue taking it so that it can be completely cleared from your system. Otherwise, when it comes back, it's coming back with some resistance and a worse form of the ailment.
But what happens is in cases where, let me say, issues beyond your control make you miss your medication? Some people end up taking double dose just to meet up with the ones that
I wouldn't advise double dose because you are now you're working your kidney and your liver. So just keep on taking it. But it wouldn't be nice to miss up to 2 doses. But assuming you miss 2 doses, fine. Maybe you can start all over again. Okay. Assuming you're giving a medication for 5 days and you miss 2 days, my advice would be just maybe you start all over again. But if it was a 1-day miss, you could just complete. But don't overdose. Don't take double the dose. It is never okay because you will now be overworking your organs, your major organs in your body.
I was telling somebody that you taking more than the prescribed medication is not going to solve your problem. Because the lady said she was having headache and she took 2 paracetamol, it didn't work, and then she took another 2. I'm like, it's not going to solve your problem. No, you are overdosed. You say that she feels like she needs more paracetamol to get rid of the headache.
It's wrong.
I said that means paracetamol is not working.
Now the cause of the headache.
Okay.
And not to continue taking more paracetamol. So that's where she got it wrong. So she sees the doctor and you now counsel her, clark her, and then find exactly what is the problem. And believe me, it may not even be paracetamol that is the solution. It may just be something that is non-medical. And she does that and she feels fine.
Okay. Yeah. Now, finally, just a few words. You spoke about the pharmacies and how the medical system in Nigeria is under heavy threat. How do you feel like this can be fixed in few words?
It's a big one.
Okay.
I don't know where to say. I don't think I can use few words. Okay. Well, we will have to have everybody knows his job and does it well. That's just that. You're a patient, you go to the hospital, see a doctor, get treated, get prescribed, and go with that prescription to see the pharmacist. They'll give you. Meanwhile, the pharmacist, they also advise the doctor. Sometimes the doctor can make a mistake and they can correct the doctor, no problem. Alright, but everybody should be able to do their work and the patient will be fine at the end of the day.
All right, thank you so much for coming on the program, Dr. Pius. That was having our conversation with Dr. Pius, and I'm very sure that you have been able to take down a few things that you learned from this conversation. Like he said, when you're not feeling well, go to the hospital, get tested before you go out there taking medications. And when you're given a medication, please try to follow your medications religiously. And if you miss a dose, he said do not overdose. Don't take 2. It's not going to fill in for the ones that you've missed. Just take the dose and continue as you should. And remember to please take good care of yourself. Drink a lot of water, get enough rest when you should, and try to get enough sleep so that you'll be well and healthy. Till I come your way next time, please stay healthy. Bye for now. I am Sandra Ago.